Hello, guys. So, we need to start with this topic today from the infection control guidelines, which is the water lines and water qualities. So, the organisms and that grow in water lines, biofilms, are environmental in origin and they are found in lake, rivers, and other water sources. So they flourish in the water lines of dental. So why are we reading these about water line biofilms? Because they flourish in the dental unit because the lines of the handpiece, triplex syringe, and the ultrasonic scalers are smaller in diameter and hence they have very slow flow rate and large surface areas. So there is some chance that these biofilms can deposit in these areas and they can enter the patient's mouth or patient's body through these ways. Okay, that's the reason it is recommended that it should be flushed for a minimum of 2 minutes at the start of the day and for at least 30 seconds between the patient with hand pieces in place. Flushing lines at the start of the day can reduce the bacterial level caused by overnight or weekend biofilm accumulation. So it is very important that you flush the water or your assistant will flush the water for at least 2 minutes at the start of the day and at least for 30 seconds between the patient to flush the any biofilm in that area. Which microorganism can be present in the water line sources could be Pseudomonas aeruginosa or any of these Legionella species. So water lines must be treated with the suitable chemical agent in accordance with the instructions for use. Likewise, those instructions may dictate the use of a specific protocol for sanitizing the water line. So there should be some chemicals which should be mixed in those water level to reduce the amount of biofilm. An independent or the bottled water supply can help to reduce the accumulation of biofilm as it makes adding chemical agents to the water easy to undertake. The instruction for use should be followed with the respect of, because we need to add some chemicals. So if you are just using the bottled water supply, then you can mix it in those in that bottled water and it would be very effective. The instruction for use should be followed with respect to appropriate methods to maintain the recommended quality of dental water and for monitoring water quality. This may include purging water from the lines or using sanitizing solution when the chair is not being used for extended periods. Biofilm levels in dental equipment can be minimized by using a range of measures, including either you can try something called ozonation, electrochemical activation, or chemical dosing of the water by any of these chemicals. All water lines must be fitted with the non-return or anti-traction valve to help prevent the retrograde contamination, which means if the to stop the contamination from the patient's mouth to going towards the water supply, your water line should be fitted with the non-return valves. Okay, it is very important. And the water quality, how good quality should be the water. Sterile irrigation solutions such as sterile solution as a coolant is required for surgical procedure such as dentoalveolar surgery, endodontic surgery, and dental implant placement. In line with the Australian drinking water supply water quality guidelines, water for tooth irrigation during cavity preparation and for ultrasonic clean scaling should be no less than potable standard as specified by the current edition. It means it should be equal to the drinking water level. It should be of potable standard. The number of bacteria in water used as coolant or irrigant for non-surgical dental procedures should be less than 200 CFU units per ml. Since this is a widely used international limit for, that would denote that the water is safe. Bacterial levels can be tested. How you can test the bacterial level in the water? By test strips, dip slide testers, or through commercial microbiology laboratories. Typical dip slides or dipstick tests for level of microorganisms in dental unit water lines are incubated at room temperature for up to 7 days. So they just create that medium so the bacteria would grow and then they would count the colonies. It is good practice to test microbial levels in water from dental unit water lines on a regular basis. For example, 6 monthly or annually. When tested levels are found to be below the target level of 200 CFU per ml. When high counts are found, then what you need to do, the water lines will need to undergo additional sanitizing treatment, also called shock treatment, to remove the biofilms and bring the bacterial level back to within the acceptable ranges. Each practice should develop an appropriate routine for hygiene aspects of the water bottle if present. So what you need to do with that water bottle is, water bottles on dental chair need to be checked visually for any development of biofilms, and they should be cleaned periodically to ensure that the bottle does not become contaminated. Likewise, staff who are handling water bottles or adding in chemical treatment agents must wear gloves so that skin bacteria do not contaminate the water in the bottle. Then the single use items, you just need to identify that which instruments is only single use and you need to throw them, which could be LA needles, LA cartridges, sutures, scalpel blades. Okay, so these things you just need to use them and then discard them. Single one patient use non-sterile items including disposable triple syringe tapes, disposable low and high velocity, it means the suction tapes, prophy cups, then micro brushes, disposable plastic dappen dishes, disposable impression trays. They are single use and they are non-sterile. There is no need for them to be sterilized. We can use them for a single patient and then discard them. Complete set of dental instruments, including the restorative and oral surgery instruments, are also available commercially as a single use item, having been sterilized by the manufacturer. They are single use and therefore must be disposed of immediately into the. So, if you are discarding the instrument, they should be discarded in the sharp container. The same principle must apply to the single-use Burrs. Single-use consumable items, for example, such as sharps like single-use impression trays, disposable suction tapes, then triple X tapes should be disposed of as these are not able to be reprocessed. Okay, so like there are certain things that, for example, the files or the reamers, brooches, they are to be considered single-use item because there is currently no cleaning method validated as being effective in removing the organic material from these items. So these files, matrix bands, and the reamers and brooches, they are single use and you should throw them after each patient. Okay, so you should be able to identify which are the single use item and discard them in the like whether you need to discard them in the normal bin or in the sharp bin, you should know that. And make sure that no attempts are made to reuse the single use item. Then matrix band. Matrix bands in contact with gingiva often become contaminated with blood during use, and if pushed down hard into the tissues, it will draw more blood. So a matrix band is not a surgical blade and it is not necessary to sterilize plain stainless steel matrix band before use. A wide range of matrix bands are now available, including some combined with wedges for interdental. Like there are certain types of matrix bands like sectional matrix bands or other the Toffelmites or something. So they are available and some do have wedges included with them. These are not suitable for sterilization with steam because of the heat sensitive component, which is the wedge. Other items used interdentally, such as wooden or plastic wedges, interdental brushes, dental floss, are not supplied sterile. There is no evidence base around infection around these items, so you can just use them from the stock. Then Burrs. According to the Australian standards on instrument reprocessing, items to be reused must be free of corrosion and suitable for use in order to reprocess. Stainless steel burrs which become blunt and corrode after several uses must be discarded into the shafts waste as soon as any visible sign of corrosion appear. Therefore, staff must look for the telltale signs of corrosion when these burrs are being reprocessed. Typically, this is seen after the third or fourth cycle of use, particularly when a corrosion inhibitor is not used during the reprocessing. To clean these burrs is also a difficult thing. So, without special lighting and magnification, it is not possible to properly clean and inspect burrs. For these reasons, some dental practice now opt to lower cost stainless steel burrs as a single use items to eliminate the need to clean and inspect them. This ensures that burrs, when used, are always sharp. And in such burrs, if such burrs are reused, magnification is essential to check for the cleanliness and the corrosion. And the most diamond burrs are designed to be reprocessed. The resin carrier of the diamond does degrade the multiple sterilizer cycle. Some brands of diamond burrs use chrome cobalt alloy as a matrix for the diamond particles. They are very long lasting. So here stainless steel burrs, some practices have developed the area where they just purchase the low quality burrs and they discard them after the use, but for the diamond burrs they are more long lasting. Then, most surgical burrs for dentoalveolar surgeries are designed for reprocessing and are made of materials such as tungsten carbide that do not degrade when sterilized using steam. Then implant hardware, it is essential to follow the instruction for use of for implant hardware as the material used in implant drills, impression copings and other components vary, with some being intended for reuse and other intended for single use only. So you should read the instruction. Reuse is only possible when an implant drill is undamaged and has been cleaned properly so that it is free of contamination. So we will start from this topic tomorrow, which is the instrument reprocessing. Okay, thank you so much guys for watching my video and to showing continuous support. Thank you.